And I feel like my body kind of got something out of it besides a pregnancy and a baby.
After the first couple of treatments, I stopped having pain.
We had the HSG, which showed both of my tubes were open, which was amazing.
And she's a clear passage baby.
Hello, I'm Larry Warren. Thank you for your interest in Clear Passage Therapies. We've had so many inquiries about our therapy that we decided to create this video to help explain the treatments we offer. This film will help you make an informed decision of whether our therapy may benefit you or someone you know.
Clear Passage Therapies, fulfilling dreams naturally. Our bodies are designed to function perfectly, with freedom of movement inside and out. But when we heal from infection, inflammation, surgery, or trauma, our body creates adhesions as the first step in the healing process. These adhesions glue structures together, decreasing their ability to move and function. The female reproductive organs are among the most delicate structures in our bodies. Due to their location and function, they are frequent sites of adhesions. When they become adhered, they can lose their ability to function normally. Adhesions are caused by inflammation, infection, surgery, or trauma. This includes yeast and bladder infections, inflammation such as endometriosis, PID, vaginitis, and cystitis, and any surgery such as abortion, D&C, appendectomy, and C-section. Injuries or pain in the back, hip, or tailbone are good indicators of pelvic adhesions. Endometriosis is a major cause of pelvic adhesions, sometimes accompanied by pain. Our goal is to decrease or eliminate the adhesions that are causing your pain or infertility and return your organs to a fully functional state.
When we're first injured, adhesions lay down to protect the area that's been injured. Once we've healed, those adhesions remain. It's our job to break those down. It's like going back in time from the time you were injured. Suddenly, tissues can move again. When tissues can move again, pain decreases and function increases. And along with that increase of function comes an increase in fertility for a lot of women. To call this work massage is to call the space shuttle a plane. Massage has never been shown to improve fertility rates, and neither has physical therapy. The Warren technique is the only systematic, organized, hands-on therapy in the world that has ever been shown to improve fertility success rates, decrease pelvic pain, increase sexual function, and open block fallopian tubes in scientific studies. It is totally unique. Typical patients that we see have either blocked fallopian tubes, unexplained infertility, many with unexplained infertility. They have a history of adhesions, laparoscopies, pain with intercourse or menstruation or ovulation. Some of our patients have no pain at all. A lot of our patients have histories of surgeries or traumas. A fall on your tailbone, even that fall the first time you came off a sliding board and landed on your tailbone, that's enough to cause the kind of adhesions that can really bind down the reproductive organs.
After pelvic surgery, my organs were adhered, painful, and I was infertile. And then, after recovery from a neck surgery, my neck and my upper back became tight and painful and also adhered.
Belinda and her husband Larry decided to treat her non-surgically using their hands to free adhesions, and this led to them leading their own physical therapy business, which they started here in Gainesville.
Marvin Hoyer is an experienced medical researcher. He was clinical director for one of the largest infertility treatment companies in the world.
Larry and Belinda began treating patients with pain after surgery and patients with chronic pain, and then soon something very unusual happened.
We began seeing pregnancies in women who had been diagnosed as infertile. One woman had been infertile for 7 years. Another woman was 41 years old and had been infertile for 12 years when she became pregnant following this treatment.
Our patient population is not just limited to people with infertility issues. We also see many people for pain issues also. Many of those patients have been to various healthcare practitioners that have been unable to help them in any way or give them any type of explanation for why they're in such severe pain. Oftentimes we find that there's some type of trauma or surgery that seems to correlate with the onset of their pain symptoms. After therapy, many times patients are able to go back to living a normal, happy, full life, whereas prior to therapy, they were incapacitated and unable to do just the basic activities of daily living.
At first, we were surprised to see success rates of 50, 60, 70% in so many different areas. Infertility reversal, opening blocked fallopian tubes, improving sexual function, decreasing pain. But when you think about it, what we're doing when we treat is pretty broad. We are not just trying to open that one fallopian tube or just trying to improve implantation by decreasing the microadhesions on the uterine wall. We're not just trying to decrease the pain with intercourse. What we're really trying to do is break up adhesions throughout the reproductive tract and wherever else we see that needs it. When that happens, concurrently, pain decreases and function increases throughout the area. And that's why we think we're seeing such similar high rates in all of these areas.
All treatment is conducted by licensed professionals in lovely private treatment rooms. The therapy appears to greatly decrease pelvic adhesions. For example, it has been shown to open blocked fallopian tubes, a procedure previously thought impossible without surgery. Here Belinda reads x-rays of a woman who came to her with severe pelvic adhesions. The x-ray shows that one tube opened after the therapy and the other improved. Many of their patients were diagnosed with adhesions. Others have been called simply unexplained infertility. Many have been called miracles due to their long-standing infertility before therapy.
Larry Warren and I met each other about 10 years ago. And he came to me saying he was looking for a gynecologist to work with his group, that they'd had a few patients that were infertile, actually had blocked tubes that became pregnant. And actually I was skeptical at first, but very inquisitive. I grew up with traditional medicine, but I've always been one to look for new and better ways to do things. So after looking at the charts of several patients that became pregnant after being told that they couldn't get pregnant with traditional medicine, either surgery or because of massive adhesions or tubal occlusions, which I've operated on myself, and the success rate is dismal surgically, to find the potential application of manual therapeutics in these people to be able to open blocked tubes and to actually have them become pregnant was an amazing thing to me. I was intrigued and jumped on the team with both feet and have been very happily working with Larry and Belinda and Clear Passage ever since.
When I found out I had blocked fallopian tubes, it was such a total shock for me. I went and had the HSG done. I went on my own and thought thought everything would be fine because I'd always had normal checkups. So when I had the test and the doctor, the radiologist who performed the test told me that both of my tubes were blocked, I was shocked and devastated and went home and, really was really upset.
Unique group of patients that have worked on, they had what's called bilateral tubal occlusion, and that means blocked fallopian tubes. The fallopian tubes hang off the uterus like little vacuum cleaners, and the fallopian tubes pick up the eggs from the ovaries, and blocked fallopian tubes or bilateral tubal occlusion keeps the egg and the sperm from getting together. Opening these tubes is very difficult to do. I was trained to do that. I've done it with laser, I've done it with microsurgery, and the success rate of opening blocked tubes with surgery is about 10 to 15%. And the pregnancy rate is significantly lower than you would like. With the Warren technique, we have been able to take women with bilateral blocked tubes and After 10 to 20 hours of the Wern technique, approximately 62% of them had one or both tubes open, and a significant number of those became pregnant. That's a phenomenal statistic, better than we could ever do with surgery. And again, there were no drugs involved, there was no surgery involved, and this is a technique that was relatively painless to women, but increased their chances of becoming pregnant significantly.
You know, one of our researchers said, Larry, in clinical research, we're really looking for positive changes of 3%, 5%. We feel like we've really accomplished something.
And we took these people that were basically unable to get pregnant and had 60 or so % fertility rate in a group of people that normally would have about a 5 to 10% fertility rate. That in and of itself was amazing.
Here with these studies, we're seeing changes of 50, 60, 70%, sometimes more, in infertility, opening blocked fallopian tubes, improving in vitro fertilization success rates, sexual pain, increasing orgasms. It's just remarkable.
When I came to Clear Passage, people were incredibly professional and sensitive and kind, and it was really unlike any other doctor or experience or clinic experience I'd had anywhere else. It was completely different from what I was used to.
From the beginning, we've been very selective with the therapists we choose. We've had 2,500 healthcare professionals write us asking us about training with us. We have accepted and trained less than 1% of that number. I'd like you now to hear some of these therapists speak for themselves and tell you what therapy is like from their side of the table.
It's a really special experience to be able to help someone who has been in chronic pain for many years and unable to function and to live their life the way they want to. I recently had a patient that said to me, "Thank you for giving me my life back." And it was such a great feeling for me. I don't even really know that I can put it into words. Just to know that I have changed someone's life is truly amazing. And it's what makes me get up every day and want to come to work, knowing that I have the ability to help people and that to that extent.
One of the unique things about Clear Passage Therapies is we get to spend quality time with the patients. For example, we see the patients for an hour at a time. So when a patient comes to us for an intensive, they're seen for 4 hours a day. And the unique thing about it is in the physical therapy profession, the time that was spent with patients is becoming less and less. And in my career as a physical therapist, I've started many years ago seeing patients for an hour, and it went down to 45 minutes, to 30 minutes, for 20 minutes. And by the time you say hello to somebody and goodbye to somebody, you really basically got 15 minutes of hands-on. So this is very unique in the fact that it's quality, 1 hour time. And the other unique thing is nobody interrupts us. Unless it's an absolute emergency, we have that hour and we're focused on that person for the hour. And there's nothing that can hurry that time up. So we just spend really quality 100% focus on the patient, and that's really truly unique in the world of any kind of physical therapy, manual therapy places.
I went home, I went back for a follow-up appointment with my doctor we decided to do another HSG so that we could find out where we were and kind of determine what we were going to do going forward. And he had been kind of skeptical initially that I was coming here. And the doctor was doing the HSG. He wasn't really saying very much. For me, it was much less painful than any of the other tests I'd had, so I had a feeling like, oh, maybe that's a good sign. And then after the test was completed, I kind of looked up at him, and he had a funny look on his face, and he said, "Well, that's amazing. I've never seen this before." And so I just smiled ear to ear, and so I knew that was a good sign. And then we had the HSG, which showed both of my tubes were open, which was amazing.
What it's like for me at the end of the week after I've seen a patient for 20 hours, it is so wonderful. It's like we don't want to miss Fridays, because We've taken someone from a place where they're not functioning well, they're often in a lot of pain. Oftentimes they find they don't even know how poorly they're functioning as far as sitting, walking, standing, laying. Oftentimes these people, these women, are having such painful sex, and by the end of the week they're coming to us and they're telling us they feel better than they've ever felt in their lives. They're feeling looser, freer, they're feeling like they're walking easier, taking longer steps, they don't feel bloated. Oftentimes their stomach, their abdomen feels the best that it's felt in years and years. A lot of women who come here have had sex with their husbands during the week and find that it was more pleasurable than they've had in many, many years, often all their lives. So we have this incredible bond with these women, and it's very sad at the end of the week. We feel like we're saying goodbye to family, and but it's wonderful also to see them step out into a new world for them, which it is very often.
When we first started to realize that we were able to open blocked fallopian tubes just using our hands, first it was hard to believe. But then when we kept hearing it and seeing it happen again and again, it was very exciting. We feel very blessed to be able to help bring life into the world when people have tried everything unsuccessfully. It's incredible.
There's a marvelous story of these three women who came to us, all friends, all infertile. The first who came had severe adhesions. Although she had had one child, she was told that her tubes were virtually blocked. They were quite scarred. She had endometriosis and, as I say, significant adhesions. She really wanted to have more children, to make brothers or sisters for her only child. We treated her and were fortunate enough that she became pregnant. She then went out and told a friend of hers about the treatment she had, encouraged her to come see us. The friend then said, well, you know, I've been infertile for 5 years. I've had 7 artificial inseminations, 3 miscarriages. I can get pregnant, I just can't hold them. I have severe pain, endometriosis. I just don't think this is going to happen for me. Her first friend encouraged her to just go ahead and check it out and see what you think. So her friend came, we treated her. I'll let her tell you about her pain levels, but she then became pregnant and had a beautiful little girl. Then the two of them told a third friend, a nurse. Severely scarred fallopian tubes. Her tubes were clubbed at the end, wrapped around and adhered to her ovaries. She was given less than a 10% chance of ever becoming pregnant naturally. As a matter of fact, she went through 3 in vitro fertilizations, but never became pregnant, even with one of them. We treated her and she became pregnant naturally and also had a beautiful little girl. You'll see their story here.
When we were first told we were infertile, it was heartbreaking. It was the day before Christmas. And that is a really special time of the year for many people, and it's usually when you bring the greatest gifts to your family, and that was the one thing my daughter had wanted since she was 2. Every time she went into bed, she said her prayers, she asked for brothers or sisters. And that is one of the things you have very little control over. And to be told that that was something I would never be able to give her was a very sad.
Laying on the bed, giving myself shots or having my husband give me shots that were very painful shots, and just crying and thinking there has to be a better way to conceive a child than through this much pain.
We both were evaluated and found out that I had some infertility problems that probably were going to prohibit me from having a baby naturally. The infertility specialists that we saw, 2 separate centers, both said that I had less than a 10% chance of ever getting pregnant on my own naturally. So we did the typical infertility consultations, and Over the next several years, we went through 3 in vitro fertilizations, and each one of them failed. So by that time, we were pretty disappointed and sad, and really felt like there was no other hope.
And then we had another group of patients that were pre-IVF in vitro fertilization, where they actually harvest an egg and put the egg and the sperm together. With patients undergoing in vitro fertilization, the normal fertility rate's around 40%. Once the patients had been through the Warren technique, we increased pregnancy rate significantly to approximately 67 to 70%. And I think if any IVF clinic would look at this technique as an adjunct to what they're doing, it's a natural fit, because they can do something that's natural, without drugs, without surgery, to enhance what they're doing and increase their pregnancy rates significantly. We have started measuring follicle stimulating hormone and have found significant drops in people that have come to us with infertility.
Before we came to Clear Passage, we probably spent 2 good years and close to $10,000 on fertility treatments, drugs, and surgeries.
We really just kind of held on, and we were trying to decide whether we were going to do a 4th in vitro or not. And at that same time, a friend of mine from church, who's a massage therapist in town, had asked me if I had ever heard of Clear Passage Therapies. And at the time, I really didn't want to hear about anything else, because I was really tired, just emotionally exhausted, and had put a lot of drugs in my body to try to have a baby. And just the thought of another manipulation in some way was just, and not knowing about what the therapy entailed. I listened to her and kindly thanked her for the information, but promptly forgot about it. 2 days later, a friend of mine who also had infertility problems called me up and said, "You have to go to Clear Passage Therapies and at least be evaluated." And so she bugged me about it, and I said okay, and that's kind of how we ended up here.
And we started treatments. And after I started treatments, right away I started to notice changes. Like after just the first couple of treatments, I'd always had pain with ovulation and pain with menstruation because I have endometriosis.
Now, endometriosis happens to 20% of the female population. What that is the lining of the uterus or womb gets outside the uterine cavity, inside the abdominal cavity, where it doesn't belong. So every month when a woman's having a period on the outside or vaginally, she's actually having a period on the inside, which creates a great deal of pain, creates scarring, creates adhesions, creates infertility. And these people not only are infertile, but usually are in a great deal of pain, just pain in general from moving around because things are so stuck together, or pain with intercourse, which is called dyspareunia.
One of the patient populations we see a lot are women with endometriosis, and those women come to us very frustrated and upset because they're unable to live their normal life due to the pain that they have every month. Many times those women are incapacitated in different parts of their cycle, specifically with menstruation and sometimes other portions of the cycle. And after therapy, we get such great results and reports from these patients that oftentimes they don't even know their period is coming because they don't have their normal symptoms. They're able to go back to work, they don't have to miss work, they don't have to spend days curled up in a ball in bed because we've been able to help them get rid of their pain.
After the first couple of treatments, I stopped having pain, and I thought, have I stopped ovulating? I got an ovulation kit down, I did the ovulation kit, and I was still ovulating, I just wasn't having pain. And then a period came, and I didn't have any pain with that, and I was just amazed that my pain was gone. And I thought, well, that's why I was meant to do this, because after that many years, you just don't have hope that it's really going to happen, you're really going to get pregnant. So I thought, well, I was meant to do this to get rid of my pain and, make my body healthy again. And that's what I feel like Clear Passage did for me. It made my body healthy, and then I was able to conceive. The pain went away. I just felt better. I felt more energetic. I was able to walk. that whole section of my body just felt younger, stronger, healthier. than it had before.
When I came here, there was kind of a different atmosphere. I just felt like a warm welcome. At the time, I was, emotionally exhausted from the whole thing of trying to have a baby. And even when I had my free consultation, the physical therapist that evaluated me was very compassionate, very almost understood or tried to understand what I'd already been through. And I think I really got individual care here. I felt like even just the atmosphere in each of the rooms as you got your therapy was very calming, and I feel like my body kind of got something out of it besides a pregnancy and a baby.
Her in vitro fertilization specialist said it's impossible. She couldn't have gotten pregnant, but she did, and she got pregnant without in vitro fertilization.
And Clear Passage was a very relaxed atmosphere, an atmosphere where they wanted to listen to me and my feelings about my body. They wanted to take time and focus on me when I was there and concentrate on me. It was relaxing rather than painful and stressful.
When I first found out I was pregnant with Henry, it was probably one of the most joyous moments I will ever remember. And the best part of it was we found out the year before at Christmas that we wouldn't have any more children. And I found out I was having Henry, and I had my 6-week ultrasound the day before Christmas. So, thanks to Clear Passage, I now have 2 brothers to add to my daughter's collection of siblings, and we'll see what else we add to that.
Actually, her prediction came true, and she's now had a 3rd post-therapy child naturally.
And I took a pregnancy test and it was positive, and I thought there's something wrong with this thing. So I took another one and it was positive too. And then, I went to the doctor's office, had the blood test, and I was pregnant. And of course the fear then, having had 3 miscarriages, was, am I going to miscarry again? But my body being as healthy as it was, I think that again, Clear Passage, made my body more able to carry a pregnancy, and so it stuck. It lasted.
Found out I was pregnant. Had been about 9 months since I had done the therapy, and I kind of forgot about it. We were considering adoption, and it kind of just came up, and we were just thrilled. Couldn't believe it. We promptly called Clear Passage Therapies to tell them. I'd like to introduce to you Allison Lacey. She was born January 26th of this year, and she's almost 6 months old. I really felt like the people were some of the best health professionals that I've ever met. Being a health professional myself, I meet physicians and nurses every day, and just the compassion here and the professionalism is excellent.
The patients that have had it done have been very pleased, 1, with the technique because it doesn't hurt them, 2, with the success rate as far as becoming pregnant. And another sideline to this that we've learned is female sexual function was increased tremendously in the group of people that we treated. Not only were their orgasmic rates increased, but their sexual desire was increased, their response to their partner was increased, pain was decreased. All the functions were off the chart. And this was a side benefit of this that we're exploring now with another study.
So we conducted a study on treating female sexual dysfunction. Results from this controlled study were that 96% of the participants reported decreased intercourse pain, 56% reported increased duration and intensity of orgasm, 78% reported increased arousal, lubrication 70%, satisfaction 65%. In total, 91% of the patients that we treated who had either pain with intercourse or decreased desire or arousal or lubrication had improvement going through this study. If you have to have a side effect, why not have increased orgasms, lubrication, decreased pain with intercourse, decreased menstrual pain, decreased back pain? When we first told the chief of staff of the hospital that women upon returning home were calling back telling us they were having increased orgasms, we were pretty surprised. He was actually quite surprised and encouraged us to investigate further. He told us that nearly half the women in America are thought to have some sort of sexual dysfunction, either decreased desire, arousal, lubrication, orgasm, satisfaction, or pain with intercourse. In the study that we did, 91% of the women we treated reported improved sexual function. It is so gratifying to be able to come to work each day, to put my hand on the door, go in with that patient and know the entire world can stay back there. I'm there to just help, to listen to what's going on with my hands and my heart. It's like turning back time as you start to decrease the adhesions that have formed from the healing process from years ago. The therapy has worked well by itself, but it's also worked well for women who wanted just totally natural approach. No drugs, no surgery, nothing, just these. Many patients come to us for natural fertility reversal. They want to have a child naturally, but many more come to us for therapy prior to in vitro fertilization. This is a really important aspect of our practice and a great adjunct to in vitro fertilization. In studies we have published in peer-reviewed journals, this work increased in vitro fertilization success rates to 67% versus the 41% in the control group. That is considered to be a very significant increase, and we had probability values of less than 1 in 1,000. So those are very statistically significant results. It means that as much as possible, the work is pretty much proven to significantly improve IVF success. Several patients came to us for therapy before in vitro fertilization when they had previously failed other in vitro fertilizations. When we tested out with them, we took women who had failed every IVF they had ever had, and they had failed at least 2 IVFs, never became pregnant. We treated them, and 71% became pregnant with their next transfer. 57% went full term. So that's pretty significant. It's a real blessing to feel like you've been given a gift and an opportunity to help people in this way. When you see people that come in, they have pain, or they have poor function, or they can't conceive, and they walk out and then they write you a letter that says, both of my fallopian tubes are open, or I'm pregnant, or I'm without pain for the first time in 20 years. It just makes your life worthwhile.
Oftentimes women come in here and they go, am I the worst person you've ever seen? And it's like, no, you're about what we see every day. But we've just recently seen this woman who had multiple pelvic surgeries, and she had been a very active person prior, and she was starting to have a lot of stomach pain. She's been very sick. She was not having, she was having terrible menstrual pain. She was having terrible pain with intercourse. And it was basically the scar adhesions that were creating it. And as we worked with her, we could just feel these adhesions letting go. And she would be laying on the table going, oh gosh, did you feel that? I felt that one let go. And that's what it's like. We feel these adhesions that wrap around these pain-sensitive structures, just letting go. And the great thing about something like scar adhesions, for instance, once that adhesion has let go, it doesn't come back, because there's nothing stimulating the tissue to be laying down more collagen. So we know that when we've made a change like that, it's going to stay. So it's just powerful, very, very positive work.
This work is most effective for anyone who has had an infection, bladder or yeast infection, inflammation such as endometriosis, any sort of surgery in that area, back, hip, pelvis, or any trauma or abuse, fall on your tailbone, on your back or your hip. So first we're going to go ahead and see what's going on at your uterus. You may notice there's some tightness there on that left side. Okay. So first we're just going to palpate here and see how things move what's moving and what's not. Having a little bit of difficulty on that left side. You may be able to feel that. Right side's feeling pretty good.
Yeah, much different than that.
There we go. Things are starting to free up. And good. Is that feeling okay to you? Okay. You have a pretty significant history, although you've got unexplained infertility like most of our patients. Some of our patients come in with 2-block fallopian tubes. We open fallopian tubes in about 2/3 of those. Some have significant pain, some have no pain at all. It just varies a lot.
We hear so many incredible stories from our patients. We really have pretty remarkable patients. For a lot of these patients, we're their last resort. They've been to many doctors, they've tried many different types of medications, they've had many different surgeries, and they're still having a great deal of pain. And one example is a woman, by the time I saw her, it had been 3 years, and she was totally bedbound. The only thing she got out of bed for was to go to the bathroom. She was in so much pain, she lived in her bed. She was only 42 years old, and she was on a morphine pump. So she basically had no quality in her life. I treated her externally and internally. She had also had quite a few surgeries, worked on her scars, and we were able to get her totally off of morphine. The last time that I spoke with her to check on how she was doing very well. She was swimming laps in her pool again, and she actually was so busy that she hadn't come in for treatment because she had been helping her sister-in-law pack up all the belongings in her house and helping her move. So basically, we gave this woman her life back. We hear stories like that every day. It's just really, it's such an incredible feeling. It's incredibly rewarding, you know, going home at the end of the day, knowing that we've made such a huge difference in someone's life. Being able to get them out of pain that they've been in for 10, sometimes 20 years, just makes you feel really good at the end of the day.
I think it might be interesting to hear a couple of the emails that we get, because we get some pretty interesting ones.
There is honestly no way I could have predicted how different I would feel after therapy and how noticeable the changes would be for my husband, and that has been really exciting. In short, Clear Passage is by far the best thing I've done for myself in a long time. After years of fertility treatments that sapped my physical, mental, and emotional strength and left me feeling less than whole, it was so refreshing to work with people who saw me as an active partner in my own best health. It was the first time I had a fertility treatment that left me feeling that I had gained rather than lost. My libido in general has definitely increased, which is kind of weird because it had been missing in action for quite a while. There has been such a huge shift in my experience of my own body and the way it reacts. Even my husband has commented on it. My husband, by the way, sincerely thanks you all. Honestly, it's like a whole new body. I'm amazed. An extra bonus, of course, is that your therapists are all just wonderful, friendly, positive people. I truly enjoyed spending time with all of them and appreciate the words of wisdom and encouragement that they shared with me. Reminding me to be aware of what was going on emotionally really helped me to get the most out of the experience and gave me the permission I needed to use the week as my own private healing retreat. What you are all doing is such a gift. As each unsuccessful year of fertility treatment went by, I moved further and further away from my body. It became an enemy. It became this thing that I didn't know, that didn't cooperate with me, and ultimately, I felt that it gave me very little pleasure. To get all those things back, regardless of anything else that does or doesn't happen, is something that I will always be grateful for. Hey, it would be terrific to get pregnant, but I already view the trip as a success because I got back my body and my husband got back his wife. Actually, an improved model of his wife from even before our dating days, I have to say. It's hard not to buy into the idea that your body is the enemy when you have so many people treating you like it is. I've tried a lot of things to turn that around: talk therapy, yoga, and even denial. But this, for me, was the big turnaround. So thank you. Thank you, thank you. I hope you know how special you all are.
Very grateful for Clear Passage Therapies for many reasons. I truly believe God puts the right people in your path at the right times. And I think Clear Passage does that for very many people. It is the right thing.